Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist, and in today's video, I want to show you a few things that you can start to do if you have hypersensitivity after an injury. So this is not uncommon to have, especially after a surgery where there's been an incision, a cut in the skin. It's very common that the nerve endings will get very hypersensitive, and things that don't normally hurt or cause harm, such as light touch, touching different objects. Those things can actually start to become very painful, even though we know that that's not enough stress to cause tissue damage. So working on hypersensitivity involves a lot of desensitization, which is not the most fun thing to do because it will irritate the nerve endings. But the more that you practice this, the more time that you're able to spend doing this, it will actually alleviate the nerve pain. You are reteaching your nerves what normal sensation should feel like. And so they will start to release some of the pain that you've been experiencing. So let's get into this video and hope that you enjoy it. So the first step of desensitization is actually just static touch. So being able to get comfortable touching the area. So for the example of this video, I'm going to pretend that I have hypersensitivity around this part of my palm, which is common for people after like a carpal tunnel release, for instance, that area might be very sensitive to touch. So it's really important to start getting used to just static touch. You don't have to press hard. You're not necessarily creating deep tissue pressure. But I just want you to take a few deep breaths, find maybe a room that's sort of quiet. Maybe you can put on some music that you really like or a show that you like, light a candle, do things that kind of relax you, take a few deep breaths, and then start to get used to touching around the area. So you might even start a little away from the area first, and then you might get a little bit closer. Take a few deep breaths, allow your body to start to understand what's happening, the sensation that's happening there. You can also say to yourself, I'm sore, but I'm safe. Sometimes physically talking out the words that like, this is okay, can actually be really helpful. So again, this is just static touch to help with desensitization. The next progression from that is moving touch. So we just did static touch where we didn't move the object or the finger away from the hypersensitive area. Next, you're going to start to do some moving touch around the area. And again, you might start completely away from the area and getting used to what that feels like, and then working towards that area. You don't need to push really hard, but you want to push enough because if it's like really light, it's, how when you like touch yourself, really barely touch yourself and it kind of like tickles. So that's going to be actually a little more irritating. So you want to, give a little bit of pressure there and then just starting to go over that sensitive area. So that's going to be your moving touch. Once you start to feel comfortable with those, I want you to look around your house and find a few objects that have different types of texture. And when I say that, I mean start with things that are soft. So something that's really good to use is like cotton balls. So that could be a good thing. Most people have them at home. You could also opt for, maybe like a silk pillowcase or satin material. Something that doesn't have very much texture. It's all very much the same sort of feel, and it's soft. Moleskin also works really well for this if you happen to have some of that at home. So now you're going to take that soft object and you're going to apply those principles of static touch and moving touch around that sensitive area, but now we're combining that with a texture. So again, you might start a little bit away from the area. You can do some static touch first. You can move into some moving touch and just working all around that hypersensitive area. Now, bear in mind, it's not going to feel great because we know this area is really hypersensitive, But if you can spend a few minutes and be distracted, listen to some music, watch a show, turn on a podcast, something that kind of calms you down, and set a timer. Set a timer for 2 minutes to start, right? And if you can work your way up to 5 minutes or 10 minutes and do that several times a day. My recommendation is generally, up to 60 plus minutes a day of desensitization, because I just think the more the better. Little bursts throughout the day can be really effective. So again, we're just doing some texture desensitization. Once that starts to feel really, pretty good, there's less irritation or sensitivity, I want you to try and find an object that has a little bit more texture to it. So that could include, your pant leg, like jeans material might work really nicely for that. You could start to work towards maybe like a washcloth or a towel, something that just has a little bit more grain to it. And same thing, just working on static touch and moving touch. So that's kind of what texture desensitization is going to look like. Another method that I really like, that I find a lot of people seem to really like, we call it immersion. I like to use dried beans for this the best, but I didn't have any at home to demonstrate this, so I'm using dried rice. Also works. Elbow macaroni noodles. You could use unpopped popcorn kernels. Dried beans just are really nice because they're kind of smooth and soft, and so that tends to be like kind of a feel-good thing. If cold feels good to you, like if you like ice, you could also keep them in the fridge or freezer so that they're cold when you do this. But for immersion, you're going to collect that whatever dried food pantry item that you have, and you're going to get a bowl. Ideally, I'd probably use something a little larger. I just didn't want to waste a bunch of rice. But just to demo this video, I wanted to show you what that would look like. So fill the bowl, the Tupperware, the container, whatever you have. Ideally, maybe a little wider too, just so that you don't have to put your hand in a weird angle. And then you're going to literally immerse your hand in that texture. And you can play with it a little bit, so you can do some scooping. You can do some sliding back and forth. You can turn the hand in different directions. You can even just get used to laying it flat on the object as well, like on the texture. So doing some static touching. All of this can be really helpful. My personal favorite is the immersion. It just feels good. It's kind of like being a kid and playing with kinetic sand or something like that. It just feels really good to your hand. So that can be a really helpful desensitization method as well. Sorry, I've got like marbles in my mouth today or something. And then the final desensitization method that I will share today is called percussion or tapping. And so what I like to use for that is a pencil with a pencil eraser, because the eraser is a little bit softer. The best ones are the standard pencils, not mechanical, but you work with what you have. And then again, you're not necessarily like whacking the pencil into your sensitive area. Like you don't have to push that hard or hit it that hard. But if you can start to tap or just, touch kind of along those areas with that soft pencil eraser. And, if you don't have a pencil, you can use like a finger, works pretty good too. But that's going to be sort of percussion or tapping. And again, working, towards the sensitive area and spending, start with 2 minutes, but work your way up to 5 to 10 minutes of a combination of these desensitization strategies. And then the more frequently you can do them throughout the day, the better. So yeah, it's not the most fun thing, but I do think it's super helpful. It can really make a huge difference in the amount of pain that you're feeling when you develop hypersensitivity after an injury or after a surgery. And so I hope this video was helpful, and thank you for hanging in there till the end. If you made it this far, leave me a comment. Let me know what you thought. Let me know what future videos you would like to see, and I look forward to seeing you in the next one. Thank you for watching. Bye.